I'm Dr. Kelly Airey. I'm a cardiologist and electrophysiologist at Rapid City Regional Hospital. This procedure is important because it will save the lives of people who are prone to have ventricular arrhythmias. So we know that people with dilated cardiomyopathy, enlarged hearts because of either an illness that they've had or because they've had a heart attack, are prone to have ventricular arrhythmias. So for these people, this device is very beneficial to treat their cardiac arrhythmias that can result from these various disease processes. Well, we look for patients that meet the criteria for this device if either they've had a bad ventricular rhythm and they need therapy with a device such as this, or if we know that they're going to be prone to this sort of arrhythmia. So people that have dilated hearts, big hearts that don't pump very well, with large areas of scar that we know are setups for ventricular arrhythmias, we know that these people will benefit from this sort of a device. Well, for these particular patients, anytime they get a device, it's good for them to prevent them from sudden cardiac death. However, this particular device is very beneficial because it doesn't go into the bloodstream. So we're not putting leads that go through the veins and down into the heart. That's the traditional device we use, a defibrillator that goes through the subclavian vein and then down into the apex of the heart. So this device goes just on the surface of the skin, or just underneath the skin, and then tunnels around to the front of the chest. There are no leads that are going into the cardiac space. So as a result, we don't have the long-term complications of stenosed veins, veins that close down, infections, having to go back in and extract leads and put new leads into the vascular system. So in the long term, particularly for young patients that have a number of years of facing the use of this kind of a device, we can save the intravascular space and reduce the risk of infection, etc.